Hey guys, Dr. Justin McKillip here. Today I want to talk to you about chiropractic care in pregnancy. This is a question I get asked a lot in my office. The three most common questions I get asked are, now that I'm pregnant, can I still get adjusted? The second one would be, are there different techniques or different styles that you use when adjusting a mom to be? And then the third one is, why? Why should I get adjusted now that I'm pregnant? To answer these questions, yes, you can still get adjusted when you're pregnant, and I'm actually going to go through some of the benefits with you here in just a minute. The second one, there are different techniques that I'm going to use, or different techniques that can be used depending on the presentation. If we're talking breech babies, there's different techniques in order to help turn breech babies. If you're looking pubic pain, low back pain, whatever it may be, there's different techniques. There's also a different style with the adjustment as well when dealing with moms-to-be or women when they're pregnant, okay? And then the third one is why. Why should I get adjusted now that I'm pregnant? First and foremost, for better health. But let's kind of break it down here a little bit. Why should you get adjusted? 80% of women when they're pregnant are going to experience some sort of back pain. Okay, 100% of women when they're pregnant are going to experience postural changes. Now, why do we experience these postural changes, or why does every woman experience these? I'm going to break it down for you here. First off, there's a hormone called relaxin, which is pumping through your system. This hormone, what it does, it allows your joints and ligaments to relax, which is good because it gives your baby extra room to grow and develop, helps ease with delivery as well. All right. Now the flip side, or the downside to this, is that relaxing in your joints and ligaments can actually create a shifting and a shearing in your joints, which can produce a lot of discomfort and a lot of pain. Okay. The next thing that happens when we're pregnant, which leads to postural changes, is the weight gain. I'm sorry I said it, but it happens. All right. Whether you're looking, baby is going to increase 7-8 pounds or a little bit more. Right. You look at larger breasts, 1 to 3 pounds. Larger uterus, you're looking at about a 1 to 2 pound there. Placenta itself, about 2 pounds. Amniotic fluid, right around that 2-3 pound mark. Increased blood volume, 3 to 4 pounds there. Increased fluid volume overall, another 3 to 4 pounds. And then fat stores increase throughout pregnancy as well, which leads to 7, 8, 9 pounds. Okay, when you add all that up, you're looking at 24 to 32, 34 pounds of total weight gain. Why is that important? Well, that then also leads into postural changes. As you gain this weight, your center of gravity starts to shift further forward, which creates your pelvis or your hips to start to tip forward as well. All right, your upper back is going to shift back to try to counterbalance that, and then your head also drifts forward. All right, when we have this pelvis shifting forward and your mid back coming back, that increases the curve in your low back, which can create a lot of jamming and pain there. The shifting backwards and the head coming forward, that puts strain not only in your neck but your upper back and shoulders as well, which can lead to a lot of undue or unneeded stress and strain in the ligaments and joints there as well. Okay. So in conclusion, when you look at this, like I said, 80% of women are going to have some sort of back pain, all right? Now, the back pain may be temporary throughout your pregnancy, but there's things that we can do to decrease that along the way and help that along the way as well, all right? And I also said 100% of women are going to experience some sort of postural shifting or postural changing. Now, the downside to that is that postural change, that can actually become habit, that can become permanent. And that's where, chiropractic adjustments, exercises, and stretches can help to turn the ball back in our favor, all right? Can help to decrease these postural changes and correct them and fix them so they don't become more of a permanent change or a permanent style down the road, which can lead to more pain, all right? So I would just strongly urge you that if you are pregnant, or if you know of somebody who is pregnant, forward this video on to them. Send this video on to them. Let them know. Let them kind of hear about some of the benefits and help them have a healthier and happier pregnancy and delivery as well.